Thank you, sir. Thank you for inviting me for this wonderful course. Been part of it for many, many years, and all the wonderful faculty that we've been part of. The inflammation connection between ocular surface and vitamin D3, no financial interest. It's been our journey of the time we started just as in clinical observation to time when we are looking at multiple areas of interest. And we have published ourselves around 30 odd papers linked to vitamin D itself for the last 10 years in all the best journal across. The last one was in ocular surface just a month back. So it's very important that we understand this relevance of vitamin D in the disease. There are many linked areas of vitamin D, not just in ophthalmology, but in different areas of medicine. In ophthalmology, goblet cell decretion, nociception, that means exaggerated response to everything, exaggerated response to washing your face, exaggerated response to just a wind or anything, change in your epithelial function, and more pro-inflammatory markers. These are all the group of people all across that just to show that a lot of people across the world have been looking at this seriously. But the two questions which always comes to the mind is, and this has been asked by everybody, whenever we started presenting it from 2010 onwards, India is vitamin deficient. Why aren't people getting it? Despite having normal level of vitamin, why do some people still develop dry eye disease? Could it be a factor? This is a very important question. Why recently, if you have seen the journal in NEJM, they spoke about vitamin D being a major factor in the patients who in the ICU, being patients who don't survive post-COVID, because there's one major factor involved is how your immunity is. There could be a relationship between the systemic and the local factors here and how the molecular things may control. Yeah, I'm saying that prevalence can be as high as 70%. So this is a paper which came 2 years back in IOBS, where we looked at all the markers the vitamin D does to change the ocular surface. Markers which cause change in Schirmer's, markers which cause discomfort. This is a very important thing. And if I want to put one thing about the vitamin D, the discomfort scale, what it does is very high. The markers which cause T-but changes and markers which cause confocal changes. This is a beautiful paper. Took 6 years for us to come out with this paper. Started in way back in 2013. And when we finished, it was 2018 or 19. So it's a huge paper, heavily cited, looking at every aspect of the vitamin D disease, from a pro-antiseptic to non-antiseptic factors, how it plays a role, and every aspect of the disease has been clearly discussed in this. I don't want to go into too deep into this. It just means that the tear film vitamin D is completely different from what you see in the blood. They're not the same. That is most important. I'll just going to show something recently, the last 2 years of work, because everything what you start has to keep going. There's never going to be an end to any of your work which you do. One of the things we looked at is genistein-controlled mechanism of hyperosmotic stress. We all talk about hyperosmolality. The question is, what actually drives this hyperosmolality? Dry eye, if you look at the Dew's definition, we say dry eye causes hyperosmolality, or hyperosmolality is related to dry eye. But the question is, what is the molecular mechanism of that hyperosmolality? And this is something very, very big Journal of Clinical and Translation Science, which we published, where we looked at these factors. What we looked at is the vitamin D receptors. Every cornea has receptors, and you must have known that, like how you have now, everybody talks of the ACE2 receptors, of multiple TIMS2 receptors for COVID. You have receptors, VDR receptors on the cornea. These receptors on the cornea has to be active for it to function, to act like an immunomodulator. If your receptors are not functioning, then it doesn't work. So this is how a receptors look like. These are all very original work. And this is a staining of the receptors in a dry eye disease, which is low. So what does it mean? The receptors are extremely low on the surface. And this is what really helps in functioning of the vitamin. How did we check? We did a conjunctive impression cytology of the ocular surface to do this, and did some special staining to do that. And hyperosmotic environment actually drops the vitamin D. That means when you have inflammation or hyperosmotic changes, the vitamin D comes down. And what really brings it down? We figured out, this is the first time we figured out a receptor called TonyEBP. And these receptors are always high in dry eye disease. And this could be the future marker in your tears for hyperosmolality. Now, when I speak about hyperosmolality, we all know 320 millimoles per osmoliter. We used the machine didn't work, and we were unhappy. And there is no real way to look at hyperosmolality check. How do you know this? This may not work at all because this is not reliable. Now, using this marker, which is also related to vitamin D, the TonyEBP would be a great marker to look at the vitamin D receptors. And this is an important slide. Increase in your calcitrol on the ocular surface, the TonyEBP reduces. That means increase your vitamin D, the TonyEBP reduces. That means hyperosmolality reduces. It's a very, very important point which needs to be done. And this is a very important form. That is why we need to have drops which contain calcitrol in the future, which we are working towards, which will improve or increase the DTR receptors and also reduce the TonyEBP, which is very responsible. In keratoconus, same thing. In the cone, the VDR is low. So molecular inflammation is there. So you have to treat it before you treat the keratoconus. To summarize, vitamin D supplement reduces the hyperosmolality. It looks at reducing the TonyEBP, improves the vitamin D receptors. It changes the inflammatory markers. And all this can be controlled by cholesterol-based drops of the future. This is my vision because there is a huge potential for this as a research, and this is something which we want to approach. Thank you.